Hi everyone, this is my presentation of the pamphlet that I did on Angelman syndrome or AS. Angelman syndrome is a very rare neurogenetic disease that affects about 1 in 12 to 20,000 individuals. Angelman syndrome affects both males and females, as well as all racial and ethnic groups. What occurs in Angelman syndrome is that children who have AS have a mutation or deletion of a gene on the 15th chromosome. Angelman syndrome is not typically present at birth and is not diagnosed until around the age of 2. And the first signs are lack of speech and language and lack of motor movements, crawling, walking, etc. It's diagnosed through genetic testing, and in 10% of the cases, the genetic testing comes back negative, but the clinical features are also used as a way of diagnosing that if they are significant. There are several treatment options for the symptoms. There aren't any treatment options that will actually cure AS. Speech therapy, occupational therapy, physical therapy, behavior therapy, obviously educational intervention. There's also some alternate treatments and therapies. I know hippotherapy, music therapy, and even art therapy are other ways that individuals with AS are treated. And also in many of the cases, about 80% of individuals with AS have seizures. So anti-seizure medication is also a treatment for that. The ways that it will affect development are physically, it causes ataxia, which is the inability to coordinate voluntary muscle movements. As I mentioned, seizures, microcephaly, which is a small head circumference, and less commonly, in about, I think, 20 to 80% of the cases, there are things like strabismus and scoliosis, hypopigmentation of the skin and hair, GRED, and because of those difficulties with motor movements, there can be some feeding difficulties, as well as there are some sleep abnormalities. Cognitively, AS presents with severe developmental delays, as well as a very short attention span. It's communication, as I mentioned, there's severe speech impairments. Many to most children with AS don't have communication, and many will not develop an effective method of communicating verbally throughout their lifetime. Individuals with AS also have a limited understanding of language. However, that is higher than their ability to communicate. Social emotional implications. These children are very excitable, hyperactive. They have inappropriate laughter and smiling. As far as sensory characteristics, part of that is hand flapping. And interestingly, there's a fascination with water and an increase in sensitivity to heat. When you look at what the educational implications of AS are, many children with AS are actually able to be in an inclusive classroom with typical peers. It's important to have high expectations, allow these children to make authentic choices, and it is important to have a consistent routine. Educational services, speech therapy, occupational therapy, physical therapy. There might be adaptive physical education or nursing services. These children can receive accommodations in communication, motor, gross and fine, sensory, medical, environmental accommodations are all available in the educational settings. The first steps to start those interventions are contacting your school district and setting up an initial evaluation and developing an IEP that meets all of the all of the criteria under IDEA that best meets the individual needs of your child. And the other piece of my pamphlet is information and support for families. The Angelman Syndrome Foundation is a very large support group. There's also the International Angelman Syndrome resources, which provide resources and information for 50 countries around the world, as well as cultural implications within those countries. There's some other information about epilepsy, school districts, which school district are you in, and how to find it, as well as some alternative treatments. Thank you very much, everybody.